Dental Soundbites bonus content.
Hello, I'm Dr. Effie Ioannidou.
And I'm Dr. Arnell Wright. Welcome back to another bonus episode of Dental Soundbites. We're having a conversation about the shifts and trends affecting our profession with Dr. Marko Vujicic.
So as we bring in graduating class of 57%, 60% approximately women dentists, right? In a workforce and in a society that is built for the baby boomers, I predict, and I'm not in health policy, but I predict
all the disclaimers on this episode.
Right. Disclaimer, I'm not in health policy, but unless we have a restructure of our society functions, I believe that as the female graduate class increases, without taking care of childcare and elderly care and parenting, we won't be able to see again an increase of solo practices. People want to go into the group practice because they feel that they are supported by this group, right? In case that they need to take a day off suddenly, an emergency. So I think it's a completely different. Again, unless we solve the issue of child care and elderly care for parents, I don't see that we are moving back to solo practices. But again, I'm not in health policy.
That's interesting. Yeah. Yeah, it's a good hypothesis.
For sure, but it requires a commitment from a lot of stakeholders. But it's something to think about. Maybe we can revisit or we can rediscuss in a few years. But I'm happy to talk to you, or maybe it's a hypothesis that at some point we need to solve or include it in surveys.
Maybe helping them with some research there.
It's got some other implications as well, Effie, as we think this through, right? So I'm thinking, is there an implication for what economists would call total labor supply, right? So if somebody, let's say, works 5 hours less per week or 2 hours less per week on average, right? We certainly have a lot more graduates, but if they are, let's say on average working less because of the issues you talked about, right? Caregiver responsibilities, again, both for young and old, right?
Sure.
Children and then parents.
Sure.
This is kind of the squeeze generation, right? It's like they're caring for aging parents and then they're caring for children. That could potentially have implications for, we have a lot of dentists coming out, right? But maybe the total labor supply. We haven't seen that yet because we do track average hours. So it's not like there's a huge reduction in average hours worked because we've shifted to having many more female grads coming out, right? At least in the super early part of the career. Now, lifetime, that may be different. But this is something, again, another thing we should look at a little bit more. But it's a great suggestion for some analysis.
Yeah.
All right. Thank you so much for being here again.
Thank you.
If you like this episode, share it with a friend.
Yes, ma'am.
And be sure to subscribe to the podcast wherever you listen so you can get the latest episodes.
Yes. And you can also rate it, write a review, and follow us on social media.
Bye.
Bye.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.